and thank you so much for inviting us here today. I really feel at home. Those kind ladies from social ministry, Krista and Britt, invited us for dinner and for last night, and it feels like when they are speaking that they should actually be speaking Icelandic, because the pitch in the tone it's the same as in the Icelandic. So it's quite funny. They're sitting and listening to them talk, but the sound doesn't match what I'm expecting. So thank you everyone for joining us this morning. It's a real honor to be here, and we hope that our story of improving services to blind and visually impaired and deafblind will help you in your journey to improve the services in your country. I think I visited here Tartu School for the Blind many years ago, and I was really inspired on what they are doing there. But I could hear that from the social ministry that your services are a bit different than us in Iceland, so that's why they asked us to come and share how we are doing it. With me today are 4 ladies, because we wanted to represent our country as its best. So with me today is Vala, who is head of our service for adults and the elderly, Heiður, who is the head of service for children, and you will hear them speak later today, and also Estella, who is head of innovation and purchasing, but also my close colleague, so she will be talking a little bit later today about how we, what do you call it, like how a referral team works. But my name is Elfa Hermannsdottir, and I'm the director of the National Institute for the Blind and Visually Impaired and Deafblind in Iceland. We recently got a new name in Icelandic, which is a lot shorter than what we have here today. So we haven't figured out the English name yet. So we will be saying the Institute or the Vision Center or something like that. So we will be referring to our service when we say use these words. I was so lucky that I came to work in VI in 2007, and that's when they started building up the services in Iceland. So I was able to participate in the history, and I would like to tell you a little bit about the history. Even though I don't know everything, I'm gonna have some assistance on some videos later on. So our historical background is that around 2000 and prior 2000, we had a lot of challenges in our system. There were around 12 to 1500 clients who weren't getting the proper services, and the main focus was on health. We had a center that was run by an ophthalmologist with optometrist, and the most focus was on that service and allocation of glasses. And there was constant criticism on that people weren't getting the right service. There were only a few professionals who were available to deliver the services, and there was a lot of inequality. Families were moving abroad. They were getting news articles that children weren't receiving anything at school, and etc. etc. So there were a lot of reports on the services saying how bad it was, and it wasn't until 2003 that the Ministry of Education decided that we needed to do something. So they did a report, And then came another report. You know how it works with the government. They really love their reports. And all were basing the same, that we needed education, we needed daily living skills, we needed people going out to the workplaces, people were not in universities, and when I say people, I'm talking about the VI population. So what was to be done? So the Blind Association got in 2 people from the UK, which they made a lot of fun about in the old days because they were called John and Paul. So they were called the Beatles. But the fancy name is called the Harris and Holland Review. So in 2006, they got in international experts to say the same things that had been said over the years. And their findings confirmed that what many local stakeholders already knew, that the services were fragmented and there was hardly any coordination. And what they suggested was to establish a national database so we would be able to track students' needs and services, and that we should develop standardized assessment and protocols, and we should create a knowledge center that would be dedicated to blind and visually impaired and deafblind individuals. They also suggested that we should strengthen the teachers' training in our university colleges, so they would be ready to teach VI students. Well, using this report, and because it came from abroad, things started to roll. So the Ministry of Social Affairs in 2007 agreed that they would establish this new center, and they created an emergency fund to use to train professionals to get the resources in the country. We only had 1 teachers who were working with the blind, and I think 1 or 2 mobility teachers, and then the optometrist. But the center was supposed to be with 25 members of staff, and in that center, we were supposed to have specialist teachers, mobility instructors, social workers, psychologists, and assistive technology specialists. And this was the estimate, so we could serve the whole population of Iceland, not just in one municipality or you know how it is often in communes. But this center was to be for the whole of Iceland. So the insight from this report gave Iceland a broader perspective and evidence-based recommendations to proceed. And now I would like to show you a video. These are our former chairs of the blind associations. Because they wanted to speak Icelandic, we translated them. So each one of them has their own speech synthesizers. So they are speaking English, and they really like to hear how they sounded in a speech synthesizer. But here they are talking together about how the history behind it and what needed to be done. The person, for those who have vision, the person in the gray sweater is Halldór, and he was the chair at the time when all those reports were being published, and he was one of them that started the reforms and later became our colleague at the center. He started working at the center. And Kristin, who was the chair in 2008, and is now the what do you call it? The CEO of the Blind Association. So he's no longer the chair, but he's still working in the Blind Association. So let's see if the video works. Should I press play or do you?
Today, I'm speaking with Halldór and Kristen about how services for blind and visually impaired individuals in Iceland have evolved over time.
In 2004 to 2005, the Special Education Department for the Blind at Álftamýraskóli was closed. Services were discontinued, but the intention was to provide advisory services nationwide, just 5 hours a week, and that for all school levels. Unfortunately, the specialists were either retiring or reaching retirement age. The big question at the time was, who would continue providing services after the system was phased out?
Around 2005, some parents began moving abroad to countries that offered better education opportunities for blind and visually impaired children. That was when we started working with the government, once they realized how serious the situation had become. The Blind Association even invited international experts to come and say the very same things we had been trying to say ourselves. Sometimes it takes experts from abroad to make people listen.
A small but determined advocacy group formed, determined to change the situation. When experts from England came and assessed the system, ministers and MPs began paying more attention. A new framework was drawn up, and professionals were sent abroad for training because no local education programs were available. 4 teachers trained to work with blind children, and 4 more trained in mobility instruction. Since then, we've worked hard to maintain that capacity.
Eventually, the state took over responsibility because schools, especially in rural areas, couldn't always handle this on their own. After all, how often does a small rural school expect to have a blind child enrolled?
The responsibility for services had been spread across 3 ministries and over 80 municipalities. The municipalities wanted to decide for themselves how much advisory service they would buy, but it was obvious that they wouldn't purchase enough. So the minister decided the state would take over the service and municipalities wouldn't have to pay for it.
The Blind Association and the Blind Friends Association set up a fund to finance specialist training abroad. These professionals were scheduled to start on January 1st, 2009, when the Ministry of Social Affairs would officially take over funding.
During the preparations, the Blind Association agreed to host the professionals' work because the authorities couldn't organize the facilities themselves. The association even found housing for the new center. It would have been difficult for the state to arrange that during the financial crisis. Today, the center is housed in even better facilities within our own building. We believe that services for the blind and visually impaired should be provided under one roof.
It's crucial that the Blind Association participated in building the Vision Center. We don't try to be the specialists ourselves. We focus on training and supporting them and using their expertise. We've always prioritized having a scholarship fund to support specialist training.
The Blind Association has invested significant resources in developing services, importing guide dogs, developing Icelandic screen readers, and building excellent facilities. Supporting this work is crucial. The results speak for themselves. At the beginning, there were only 1 or 2 university students. Today, there are around 20 at any given time. Educational levels have increased dramatically, with people now actively participating in education and daily life.
The Blind Association has always viewed the Vision Center as an ally. We've never had conflicts with the center, while in other places, time and energy often get wasted on disputes.
It's essential that the services are provided in the same building so that we can support each other. We provide peer support while the professionals carry out their work.
Thank you for joining us for this conversation about the development of services for the blind and visually impaired in Iceland.
So, like you can hear, it's really important that the grassroots took over and pushed the development forward. So, like they told you earlier, we started in 2007 with the emergency fund, and they implemented the Ministry of Education established a implementation committee that was using the Holland and Harris report, and it included stakeholders from all over the system, because there had to be a consensus. So in the committee was Ministry of Education, the Blind Association, the Ministry of Health and Social Security, City of Reykjavik, and the Association of the other smaller municipality, and then the Ministry of Social Affairs. This ministry was supposed to develop a proposal to improve services and create an integrated system that would service the population of visually impaired better. The committee focused on ensuring consistent, coordinated services across the country. They proposed the creation of a centralized service center under the Ministry of Social Affairs to coordinate services in education, rehabilitation, and social services and healthcare. So there was a 2-day working meeting in June 2007 who brought all these people together, closed them in a room so they would make the findings, and so we could start working straight away. And like I told you earlier, they put in like emergency funding from the government so this could happen. And I was so lucky that in 2007 I was one of those people who received funding to go abroad and do studies in visual impairment for blind and studies in special education for blind and visually impaired students. So they did that. They approved to fund for special teachers and then mobility and daily living teachers. Yeah, I think I'm trying to read the screen. And I also want to ask you, if you have any questions, then raise your hands, and it will be more, fun to have it interactive. But I know that when it's a bit of a story time, it can get heavy. But I think the story is important, so you get the feeling of how we got there.
Elva, we have a question.
Yeah.
Yeah, tuleb küsimus.
Several ones, actually. My name is Britta Marandi. I work in therapy center Nessa, and I work with babies who are blind and deafblind, and since the beginning of 3 months until 8 months. So they come to me, and then we decide what's next. Mm-hmm. I have a question for the assessment part. You said that you have some assessment. Who does it? Which one is it? How does it work?
Mm-hmm. Thank you. Regarding the babies and the children, there will be a special lecture about that with Heiður and Estella. So I'm gonna ask them to answer this question a little bit later, so you will get the full spectrum of it.
Okay. And the second question is do you have a university who trains the specialists, and which specialists are there? In Estonia, we have special education teacher, we have physios, we have OTs, but we don't have the one training for the group of deaf and deafblind. So how does it work there?
Mm-hmm. Well, especially for the deafblind, we are in a bit of a situation ourselves. So we are responsible for coordinating the deafblind service, and Estella will tell you about that later. But we have a system that with the Nordic countries. So we don't have a formal education, but once people reach the services, they are able to do some studies within the Nordic Welfare Center.
Okay, so in universities you don't have like special. Okay.
And we still don't, you know. And I'm going to tell you a little bit how we do it to ensure that the education stays on, so it doesn't flatten out, because that's been happening all over Europe, that the education or the specialization is getting like flatter, if you know what I mean.
Okay, and the artificial aids, in which age does they have the artificial aids? Who recommends, who decides that they get them? We have this field, it's nearly empty. We don't have artificial aids so much for like common sense. We have to like buy them our own, or some specialists are recommending, but it's not like everybody gets them. How is in your country?
I'll get that.
Okay. And next, who? Sorry.
Yeah, no, it's good.
Who you hand up? Advises or guides families with babies in their homes or in the hospitals. Who are those people in your country?
It's us.
Okay, only you?
Yes. No. I mean the center. The center does.
But if they are in the hospital, you go to the hospital.
Yes.
Okay, and when they are in the when they are in the families, doctors, does the doctor also call you to advise the family all over the country?
Yes.
Okay.
So the model of our system is we went from medical model, where everything was based on the ophthalmologist, to the social model of disability. So that is the one that is in charge. So it's not the health part, it's not the ophthalmologists that are in charge. It's the knowledge or us at the research center. Okay,
but next, that's actually, I hope it's the last one, but the help, tugisik, support person, in what the age does the child or the family gets the support person?
Just from beginning. So if you are blind or visually impaired in Iceland, you're stuck with us from age 0.
So we have a lot to learn.
Yeah.
Thank you.
So
Yeah, thank you, Britta.
Yeah.
And that kind of interaction is
I think
something
that's
that
really
we like.
important. So please carry on and you know, because when you're speaking in your second language, you're not always telling things like the way you want to tell them, and they're not as clear. And you think, or I think I'm being very clear. So I think it's really important that you help us out. So after the collapse in 2008, the famous economic collapse, these services, or the initiative in establishing these services, was the only act that was accepted at the government. So we were able to start in 1st of January 2009. And within our services, so there were 3 parts that our service center came together from, which is Bjornsson Iceland, which is the old part of our service, which is more like ophthalmologist and optometrist. And then a section from the blind library, or the audiobook library. It depends on how you translate it, but it was the only the Braille part that came in from there. So in Iceland we call it now the audiobook library, because it's only servicing audiobooks, but not Braille or large prints. That is us, in the Knowledge Center, that does that. And then, because the municipalities were supposed to support both families and education and things like that, and some of it was already done by the Blind Association, those positions went into our service center. So everything was put in one, And like I told you earlier, if you were born blind or visually impaired, the center would be your starting point. And then, of course, if you got diagnosed or if you got visual impairment later in life, center would be your starting point. So we better be, we better be good professionals, and we better keep up the good service because people are stuck with us. So that's really, really important for us. So the key elements in our service model is that the person itself, it's the client that is in the middle, and we talk about client or user of service, just so you understand. So it's not like client as in business, but but we're going to use that today. But because you are the user of the service, then we would translate it as a user, and we would never refer to people as patients like it was done before. With this, we got the centralized coordination. So we are the one who are responsible to know how much service each person should get and provide it. We are responsible for holding a national database, so we know about everyone who is blind or visually impaired or deafblind. And we are responsible in doing our own training and other training in other communes or municipalities. I have a picture there, and on the picture it says person-centered approach, access regardless of location, integrated support, and participation in decisions. So today, this is what we're going to try to explain to you, how we are working with that approach, differently with children and adults and the elderly. Each client who has multiple needs, he would get a contact person. Not everybody would get a contact person if you are, for example, elderly and we assess you that you're not able to learn so many new things, you wouldn't need to get a contact person. But if you're like a young person, you would get one contact person. So if you call in or email or whatever, you would always go through that person. So that person knows you and your needs. And that person would be responsible in letting the other staff members know. For example, if somebody calls in and says, I need to learn a new route, so I need training in mobility. If the contact person isn't a mobility teacher, he would talk to the mobility teacher and ask him to call the person, and they would meet up. So we try to keep it as holistic as possible, and remember that the services go beyond healthcare and education. There's so much more in a person's life. So there are all kinds of things that we need to work with, things that we wouldn't even think of. I mean, people go or students go to summer school, so we need to prepare them for that. Or people are in all kinds of clubs and things like that. So we if people ask us, then we do help. But also we try to be proactive, and so for example, with the children, we are ahead. So we contact the school or the families even before they, need us. So I have a question here.
Aitäh. Mina olen Merike Kaljujärv Vanalinna hariduskolleegiumist.
Jah.
Ja. Saan aru.
Jah.
Ja. Et te viitasite selle andmebaasile. Riiklikule andmebaasile ja et keskus vastutab selle eest. Kuidas te neid andmeid kogute?
Yeah, we collect the data with referrals. So we work closely with the ophthalmologist. So if a child, for example, is born in the hospital, then they would refer it to us. So we would put it in our system. And I don't think we have it on our slides today because we were talking about this last night with Krista and Britt. But we also have a medical system. So, for example, there's a medical database in Iceland which the GPs use or the hospital. So we also use that. So even though for example, we have a part-time ophthalmologist who is able to send out information or get information from that system. So that's our key in and out. That's how we communicate with the healthcare system. So that really helps us to and then it's also easier for the ophthalmologists to refer to us because they are using the same system. So they, electronic database, they would just send out their referral there. So nobody gets lost. Now, when we were established in 2008, there's a special law on our center. So that's not very common in other countries that an institute has its own law, especially a small institute like this. So in the law, it states that the center should enable individuals with blindness, visual impairment, and those with combined vision and hearing impairment to live an active, independent life and participate fully in society, in education, work, and social life. So this is just what it says in the law that we should be doing. And this is based on the UN Convention on the Rights of Persons with Disabilities. So the working group actually used the convention on the rights of persons with disabilities to make this law. So everything is very much centered about the UN Convention. And what this gives people is a legal basis for a unified and a coherent system. So people know we are the ones who are responsible for the service, and even though we're not responsible, we will help you and guide you through the system. So, and also by having it in the law, it gives us the right to collect the documents and keep the database of our clients, because that's also what you need to consider with all the GDPR and things like that, data protection. It's also really important that we are based on the Ministry of Social Affairs, because the Social Affairs Ministry is responsible for inclusion and equal opportunities. And instead of being under health, this is more empowering for individuals, and it's more focused on independence and living life, inclusively. Because blindness and low vision, they don't only affect health, as you know, it affects the whole life. It affects education, it affects work, daily living, all kinds of social integration. And by housing it there, it also aligns with the national disability policy in our country. And what we are very proud of today is that our current Minister of Social Affairs is actually legally blind. She came in office, I think, I'm forgetting to count. It's like six months ago or something. And she says publicly that she wouldn't be there in office without the help of the Knowledge Center. Because she's actually started late in studying to become a lawyer. And the center produced all her books in large print. So you can imagine all those law books, like, in 36 points, And she said, like, it was a turning point in her life that this service was available. And you can see she is probably 70 something today, even though you're not supposed to talk about women age. But for her, she was able to start in her 50s, something that she wasn't able to do before. And I remember the ordering coming in for the books and the paper going out, and we were like, wow. But she was determined. And she's, like I said, she says this publicly, that everybody should have a system like this, because we are having a really hard time with our other sensory, the hearing. So. And they don't have a consensus like this in Iceland. So they are actually like we were in 2007. They are kind of, nobody has responsibility. And so they are always looking to, those visually impaired people, they get everything. We have a question here on front row.
Hi, good morning. My name is Jakob Rosin. I'm the chair of Estonian Blind Union. First of all, it's a fantastic benchmark. We're going to take it over. The next social minister will be a blind person in Estonia, not me. But I was actually curious because the system you're explaining and the way you approach this all sounds actually truly amazing and human-centered, which is fantastic. Do you have any overview? Maybe this will come later on, and if it does, then it's totally fine. How has it impacted the employment of blind people in general in the country? Because what we see is quite low rates. It's the barrier to get to work is really low, and the let's say the complexity of the work is also quite low. So if you look around in other countries, we see sometimes lawyers, sometimes engineers, developers, etc., who are blind. How does the landscape of employment do look in Iceland? Thank you.
Thank you. That's a really good question, because if I go back to the university studies, when we started in 2007, we only had maybe 1 or 2 university students, and one student was even paid to go abroad because they didn't know how to, service them. But now today we are having probably 15 to 20 university students all over. There is still a challenge to get into the labor market, but we are still seeing increase in that, and we are higher in participation in labor market than in other Nordic countries. So I don't have the correct number for you, but I know we are higher. And we are actually now, as we speak, gathering information. We're having a survey with our clients to ask them if they are employed, or if they're not employed, if there are some kind of activity, because we have all the emails of the people who are registered on the working aid, so it's easy for us to get that information. So that's like what we're currently doing, because there's also some changes now in the benefit system that are coming up, which we will tell you a little bit more about, or our social worker. I have a video of that. So we wanted to have the exact statistics before the change would happen. So higher, but not as high as we would want it. But we also do our own initiative to help people get into the labor market, and I have a slide about that. So the key mandates of the center is that we are supposed to assess and give provision. And again, to look at the person as a whole. And when we talk about assessment, we mean functional assessment. We're not talking medical assessment. So we look at the person with the eyes of ICF, or International Classification of Function, that you should look at what a person can do, but what they cannot, not what they cannot do. And we also, I will tell you about the allocation of devices a little bit later, but in this assessment, we also assess the needs of the person to make sure that they get the right devices, and not necessarily the cheapest ones, but what they need. Yeah, and it's really great to see how, because now we are seeing kids who were at school in 2007 that have gone through university and graduated. So it's been such a pleasure to see their journey and how they grown and how they were able to get through all their struggles. So, like Heiður will tell you, we go into each school of our client and see them there and help the teachers out. We're not so much in direct teaching. We try to have the teachers teach, so the students aren't any different than other students. But sometimes we do direct teaching, such as in Braille and you know, sometimes in math, things that are maybe more difficult for the teachers, if it's something very specialized. But we hold courses for them so they are able to teach themselves. And also, daily living skills is one of the key mandates. Everybody has the right of a mobility training, right to learn Braille, orientation, and life skills. And what we are seeing in Iceland, like in other countries, is that there is less interest in Braille, but we are trying to do everything we can to support the Braille so it keeps, you know, stays alive. Our staff, they go to a lot of courses or seminars abroad, and that's really important. Of course, it's always you know, difficult to justify, but being the only center in Iceland, this is just something that we need to do. We need to collaborate with other countries and see what they are doing, and bring back the knowledge home. And like I tell you, we try to maybe discuss with somebody else about VI, visual impairment or blindness, and we are very excited, but then the person we are talking to, they're not that excited. You know how it is. Because it's such a small field, then it's so great to be somewhere else when people are working on the same matters as you are. And we also need to be ahead of our clients, because about the internet and all the devices that are out there, we have to be able to tell the people about what is out there, and if they see something, they are very much now educated, because people are online and say, well, I saw this online, can I try this, or what do you think about that? So we need to know what's there. Also, in our law, it states that we should help with work and leisure, such as employment counseling, all kinds of skills training, and workplace support. So if a person starts a new workplace, we would, if they want us, we would do mobility training with them, or we would hold seminars with the employer or the other employees. So, you know, they get out of the way all the awkward questions that often come up. Now, also in the law, we're supposed to do research and we're supposed to do knowledge sharing. We're supposed to allocate guide dogs and assistive technology and coordinate the deafblind service in Iceland. When we talk about holistic services, there's a list on a slide that I will go through to tell you about what we mean by holistic services. And then we have a question. Yep.
Hello, my name is Kristel Soganbits from NGO Challenge Your Senses. I have two questions, quite separate ones actually. One is, how do you work with people who have multiple disabilities, for example, vision and mobility, or vision and mental illness? Do you have specialists, or do you cooperate with other organizations?
Yeah, we don't have a special specialist for that, but we cooperate with others. So we would have, for example, if there's, as you mentioned, mental illness, we would then cooperate with the person who is assisting the person with that. So we could teach them, for example, if it's like mobility or suggestion about what can be done as an activities, what needs to be done if they need like tactile work and things like that. And the same is with the people with multiple disabilities. So it's also a question, what is your first disability, even though we don't look at it that way, but then, you know, it's kind of like what helps the person the most. So that's why we try to go to the person who is, for example, if there's a person there from the commune working with the person, we try to advise the person there what they can do with the person. Yeah.
Thank you. And the second question is about guide dogs. You mentioned that you should spread the word about guide dogs and so on. Does your center train guide dogs also, or you have separate organizations who train guide dogs? And how does the financing of the guide dogs work?
I'm going to tell you a little bit about guide dogs later on, because yes, we are responsible for the guide dogs, but we have a different system for that than in other countries. So I think it would be interesting for you guys to hear about it, since I heard that there are not that many guide dogs in Estonia. Am I correct?
That's true. That's true.
Yeah.
We have about 5 right now.
Okay. Yeah, we have now 18 working guide dogs, and I should have told you earlier, our population is 390,000. So it's a big difference between countries. And even I know that you don't consider you big, but but we beat you. We are smaller, but we also have a lot of landscape to cover. So because people are scattered all over the country.
Maybe you should try to train miniature horses for guide horses.
Yeah, we've seen that.
Thank you very much.
Thank you. Yes, I will. I will show you, and I actually have an interview with a guide dog user who works with us. So I'll show you that a little bit later on. I just wanted to clarify when we are talking about holistic services is we talk about eye examination and functional evaluation of sight. And that means that the person has actually been diagnosed at their ophthalmologist office. But they come to us after they've been diagnosed, and we do other kind of assessment. We do the assessment that goes into our database. It's like the visual category and what's the main diagnosis and so on. And most of our clients are not meeting our ophthalmologist. They should be with their ophthalmologist, but they see an optometrist who is doing the functional assessment and then makes equipment that can support people in their daily lives. We have to do a lot of records and certificates. So after, for example, after each school visit, we would have to do some kind of a record of that. And we also have to do certificates to prove that people are in our service, so they get what they are legally have legal rights to. Our ophthalmologist has to do a lot of certificates just to prove that people have the rights to services. So the ophthalmologist in the outside, they don't like to do that. So that's something that we make sure that people have the right records and certificates, because if they don't, then they wouldn't get the full benefits. We do counseling by social workers who assist on the social insurance and benefits. We provide psychological support. For example, we are now experimenting with a psychology course called ACT, or acceptance therapy, with our clients. But we also do one-on-one counseling too, and we look at it as you get, it's like allocative device. So that's how we do the psychologist. Psychologist is not actually employed by us, but we use psychologists from outside our center. We provide the assistive devices and show how to use it. We train people in like computers or software or related technology. We train people for mobility and independent living. We do counseling for schools at all levels, from kindergarten to university. And it's really interesting because in the law it says that the university should do it themselves, but because we have it in our law, we kind of end up, we are responsible for it. And I think it's really important because a lot of our students are still having fights with the university because still teachers at university levels are not educated enough. They still don't understand that PowerPoint isn't that accessible and so on. We teach Braille to students, teachers and family. We make large print, and like earlier we do the guide dogs and then Deafblind services. Now I want you to see a video of Steinun, who is our social worker, and she's gonna tell you what she does at work. And actually we would, if in a perfect world, we would like to have at least 2 social workers, because there's so much to do with all the systems out there, the collaboration with the communes and things like that. So, but it's better that she tells herself. So one of the technicians is gonna put on a video for us.
About my job here. social situation in their lives and help them to get support from other systems.
What systems would that be?
Mainly social systems and almannatryggingakerfið.
Yeah, so they're like the disability benefits and to get the insurance and everything like that.
Yeah, and also support at home.
Yeah, from the communes. So people get support at home from the communes because they are blind or legally blind.
Yeah, and also transports. So you can go from A to B.
Yeah.
Work, schools.
Yeah. So it's kind of like holistic services for the clients. Even though we are not providing all the services, you make sure they get the services needed.
Yeah. Because here at Bjornsson we have more specialized knowledge of the situation, and we can explain it to other systems, and we can help them to talk to other systems.
And are the other social workers who work, for example, at communes or at the city council, are they contacting you a lot because of the clients?
Yeah, they do. Sometimes I contact.
But how does the disability system work for people with visual impairment?
The current system is that if you're legally blind, you can get fully benefits from the government. You can also work, but it depends on how much salary it is, what you will get. But they are changing the assessment this fall, so everybody needs to go through assessment, which depends on ICF
criteria. Yeah. And do you think there will be a lot of changes for the group?
I hope that we have a group that feeling hard to work, but they can't get the benefits now. I think in the new system, I hope they will get some, like, it's not fully benefits, but like 80%, and then they can work with as a part-time job.
And get therefore more money.
Yeah.
You collaborate a lot with other professionals here in-house, such as the teachers or the mobility instructors. How does that fit with, how do you fit into the system here at the Institute?
Yeah, I think it's really good to work with others because we help each other. They explain for me and I explain for them. And sometimes we work together in cases, and sometimes they vísa á.
Oh, they refer to you.
Yeah. They refer to me the cases. I think it's really good and necessary to have social worker here, because when they are meeting other professionals here, it's an easy way to talk to me, and it's like a short way.
Yeah. The support system now in Iceland, is there anything you would like to see?
Yeah, what she was going to tell us, well, like would you like to see some changes in the support system in Iceland? Is that she was going to say that she would like more services for the visually impaired, not because today the legally blind can get a taxi service, but if you have 30% vision or less, you don't get it. You only get driving services from the communes, which are not as flexible. But we will also tell you about that for the service for the adults. Our social worker and other staff members, they work very closely with Directorate of Labor, because the Directorate of Labor is responsible for finding jobs for people with disability. So we are always trying to push the Directorate of Labor to keep an open mind, and we often go with clients to see the officer who is responsible for finding a job with them, so they realize what a person can and cannot do, because often a person is afraid to, to say how they are or what they would like. So we kind of try to help them, but still that they are independent. The upcoming changes in the system that Steinunn talked about is that now, if you were legally blind in Iceland, you would go straight to have full benefits. But in the fall and in September, it will change. So everybody will have to go through ICF assessment, and they will have some kind of a committee to identify what people can do. So it won't be as automatic as before. And they're gonna make this, make the wait longer till you will receive benefits. You will be on a in-between plan before you receive full benefits. But of course, a person will receive benefits, but in a different way. So I cannot. Maybe Vala can help me later on with explaining it. Like I told you, we are person-centered, and we have. It doesn't matter what age people are when they come to us. We always do the assessment with you, and you get all the services you need. And also, because you were asking about people with other disabilities, for example, if people would live in a home or be in a workplace, we would go there and educate the people working with you. We host family meetings and educate families. We go into people's homes. If we always offer people, do you want to come to us, or do you want us to come to you? So people always have a choice, and often, usually people choose to come to us. But often after they've been to us, they accept our visit, because then they know what we can do for them. We actually were visited by a consultancy service who was going to do helping with changing the law of children in Iceland. So I'm going to quote them. The service culture of the Institute for the Blind and the proactive approach the institution takes towards service delivery for users, regardless of locations, serves as a model. So nobody else is working like us in Iceland, that we go out there and we are ahead of the teachers. We contact them before something happens. There is every reason to consider whether other institutions providing services to people with disabilities could learn from the Institute and potentially establish collaboration among themselves in areas such as training and education for teachers and school staff. The service culture of the Institute and the proactive approach the Institute takes towards service delivery for users, regardless of location, serves as a model. So that's, again, a model. So they would actually like us to be a model in Iceland for other disability services. I mean, again, the community is very small, and it's important to have it in one place, because how are you gonna, if you are in a commune with people who are 3,000, how are you gonna provide a specialized service for one visually impaired child? That's why we need to have the service in one place, so you're not always starting over and over again. I want to tell you about our Braille and large print services. So if you are in school or wherever, you can order everything in Braille or large print. We are now not printing as much out on paper as before. Mostly people are getting it in their computers. And when we talk about orders, it can be from like one sheet of paper up to a larger book. We've always had a little bit difficulty with our speech synthesizers because being such a small country, it's fairly new that we have a speech synthesizer. For example, we still don't have an Icelandic speech synthesizer on the Apple phones, but they are very helpful. In the last year, we received 900 or something orders. Most of them were large print, and many of them were just electronical, so people could use the computers to make them accessible. The year before that, we had around 1,100 orders, but this year, I think we're already up to 850 something. And the reason is because finally we have like a bank of books, so we already have so much material that we can send out. So finally we are able to put focus on the leisure books, because in the beginning there were 5 people working constantly just on the school books, because there's nothing in the law in Iceland that says that the school books should be made differently. So, but we are seeing changes in that now because of the Marrakesh Convention, that publishers are now making more accessible books, so we don't have to fix them as much. In total, there are only 55 individuals using the service, because we've been able to reduce it with other technology, so people are able to help themselves, but still it's very important, especially for the young children who are starting to learn to read, that they have a book in hand. Yes, and also it can be just various, we never know how many orders we will get. And now there are a few students transitioning from elementary school to college. So we know that there's going to be a lot of work this fall. I also want to tell you about a project that we are developing. So because we are so small and work closely together, we are able to see the gaps or the opportunities in our system. So what we are doing now is that we're going to apply for a European fund, so to ask the European Union to help us, so we can just make the artificial intelligence help us with producing the large print book. That the AI would have a specific format, so we would just have to put the book in, and the AI would, by some kind of a magic, have the book ready for us with the pictures and everything. And of course, the AI now can describe pictures and everything, so things should be even more accessible. So that's something that we are looking into. We are also, it's kind of like a leftover from previous system. We service the general public with glass refund. So all of the children who need glasses in Iceland, they get the glass in the glasses, part of them refunded. So we are responsible for that service. And the reason why I tell you this is because it takes up still a lot of time, even though it doesn't sound like much. It's not specialized. You asked in some of the questions that you sent to us is like who is working on your in your center. We have now 20 positions, but 26 employees. Like everywhere, things start good and then the cutbacks come. Remember we started 25. We have optometrists, we have teachers of VI working, we have mobility teachers, we have one ophthalmologist, social worker, daily living teachers, computer and technical advisors, Braille production specialist, and then all admin and support staff. And of course, we would like more staff. We would like to have more teachers of the VI and more ADL teachers, but this is what we live with, and we try to make the best of our services. We've gone through all kind of surveys within the governmental model where they are asking clients, like, how do you think the service was good? And we always get very good results. And there are no waiting lists for our services.
It seemed to me that there is maybe some interest in the audience to ask about
please.
Professionals working in your center. Is that true? Yes.
Thank you. Could you elaborate what profession is an ADL teacher?
Yeah, it's a daily living skills, activities of daily life.
Okay, is an occupational therapist or what is?
It is. Sometimes people are occupational therapists in their background, but then take a course who are specifically for the blind. So then we would call them activities of daily life. So for example, because we collaborate with Denmark, they have a special course just in activities of daily life for blind and visually impaired. But an occupational therapist is a very good background because it's so good to build on. But also, this could be good for developmental therapists as an add-on to that education. So.
Yes, another question. Tule mikrofoniga.
Hello, this is Jakob Rosin from Estonian Blind Union again. So you may have touched this briefly, but maybe you could elaborate a bit. When we talk about professionals, because this is a big pain point in Estonia we see, is that having these specialized skills to work with people who have low vision or who are blind, what we're struggling with is how to teach the specialists. So if you could maybe describe a little bit, if somebody becomes let's say a special education teacher or somebody with skills in the social working sector, how do they gain the understanding of how blind people work, or what are the special needs of people with low vision? Because I believe that vision impairment is a rather specialized skill set to work with. So I would be really interested in how this works. Thank you.
Before you answer, keep in mind the question. Ma küsin ühe praktilise küsimuse, et kas teil on soe? Näidake käega. Kellel on külm? Tuul. Proovime leida tasakaalu. I asked about the temperature in the room.
Yeah.
Okay. So now to the answer.
I'm going to answer you in the next slide with how we educate our professionals, but how we do it, because people don't come to us with knowledge in blind and visually impairment. They learn it at our knowledge center, because that's what we do all day. And in the next slide, I'm going to tell you how we collaborate with other countries to ensure the knowledge. But the thing is, for example, if you're a social worker and working in a commune, you're responsible for so many different kind of needs of people. That's why we need our own social worker who specializes only in the needs of blind and visually impaired and deafblind. So she's been working with us from, I think, 2011, and she's still learning, like, what is the best. And I've asked her, because being the director of the institute, and I'm always having to think about money and cutbacks, and it's like, why should we have a social worker if there are social workers somewhere else? And I mean, we couldn't be without her, because talking to other social workers in the system is the way to work in the system. The same as with, if we wouldn't have an ophthalmologist, we wouldn't be able to talk to other ophthalmologists in the system. So they are kind of like the key persons in opening the doors to other systems. So of course we don't know everything about benefits, but the social worker at the commune knows it, but she is, for example, able to explain it. I can give you an example. There was a blind person, or she had a little vision left, but she has a child, and she went to the social worker at her commune, and of course the social worker was asking questions that they didn't really want to ask about, but for example, it's like, can you go to the bathroom alone? And she said, yes, of course I can do that. But our social worker was with her, and she said, well, what about when you are outside your home? And then yeah, of course, that's a little bit more difficult, then I would have to have maybe somebody with me to describe, where everything is, and so on. Just this little example, gives the idea that we are not always, in the right mindset when we are asking the question. And also the client, of course, you don't want to admit like you need help. Nobody wants to do that. But then, we kind of try to help people to open up, and like it's okay to admit that you need help. What we think is very important, and this is job related, is that there's very high employment in our staff of people who have visual impairment or are blind. So we have at least 4 or 5 members of staff who have disabilities, and one of them is deafblind. And this is also a way, we look at it as a way for our what we call our people to get work experience. So they can maybe come to our center and work, and we can help them to get work somewhere else. But of course there's also the Blind Association runs a sheltered workshop, so we work also with them. But this is one of the way how we help the people as a stepping stone. And we're going to play a video with Kelly, who you will see more often here today, because he's very technical, but he's going to tell you about the importance of work and belonging.
Hi, Kelly. Can you tell me your background?
I get diagnosed with RP, retinitis pigmentosa, when I am 18 or 19 years old. My visual disorder starts being a problem a little over 20 when I can no longer read normal-sized print in books and such, and have to have service from the then also named Bjornsson with that regards. Shortly thereafter, around 25, maybe 26, I start using a white cane. Luckily, I was smart enough to start doing that relatively early in my progress. So then I use a cane for about a decade, and then I have been using my guide dog for 7 years. I go through my studies. I studied to be a massage therapist, and I have always been interested in ways to overcome the problems that my eyesight has put in front of me, and that's sort of my background. And I've also done quite a lot of work for the Association of the Blind here in Iceland.
Yes, we are so lucky to have you with us.
Yay.
Yay. Why did you start working with us?
Originally, I started as a volunteer. I was then participating in a vocational rehabilitation program that we have here in Iceland. I started as a volunteer, and quickly thereafter I got offered a normal job, and that's how I started my work here.
Yeah, great. What do you think the value is to have an inclusive workplace?
I think for an institution like Bjornsson that works on behalf of blind and visually impaired people, it is of the utmost importance to have highly capable blind and visually impaired people as part of the staff, because even though we have very, very good professionals working here, the best they can do is imagine and put themselves in the situation of our users, but that will never be the same as getting the perspective from someone who's actually there and is actually going through the process and actually has a vested interest in keeping up to date on the possibilities, technology, and all the different solutions that are available to us. Someone who actually will benefit from it in their own life is much likelier to notice things that other people might overlook.
Yes, thank you.
I told you earlier that we collaborate with other agencies. We have to collaborate with the Speech and Hearing Institute because of the people with the dual sensory loss. We work with the Communication Center because some of them use sign language. We work with the Counseling and Diagnostics Center for children because there are so many children who have other disabilities, and then also in regards of CVI, it's very difficult to say who helps the best regarding that. We are also trying to form a team for adults with CVI with other rehabilitation agencies. We collaborate with the audio library. We collaborate with communes. We work very closely with the Blind Association, and one of the projects that we were working on with them is a project called Campabilities, that is an American project with that children have the experience in trying out all kinds of sports. We work very closely with the Deafblind Association, and actually Estella will tell you also about that. They actually want to move all their services to us, not be a part of the other services. We are in all kinds of partnerships, such as Inviter, which is a net of services for blind and visually impaired across Europe. We are in a Nordic network called Novir. And yes, we try to be as much out there as possible. Yeah. And I should have been more clearer earlier. All of the services that we provide are free of charge, even the allocated devices. The question about education of our staff, well, we send people abroad. We usually hire people and educate them in-house, but then we also send people abroad. For example, we use the University of Birmingham because they have a distance course. In the beginning, we used Child Vision in Ireland to teach our mobility teachers, but now we use IBOS in Denmark. So they recently just came to us and we bought a course from them on mobility training. And they collaborate with a university, so the people on the course got 10 university credits to do it, but we enabled it. So people were doing the course in their work hours. Yeah, we also work closely with Positive Eye in the UK, and they will tell you more about that later with the children seminar, but we used, when we were in 2011, Positive Eye came to us to help us put up all the quality standards and the services to the children, so we would have like a standard in how many visits each child should get. And Heiður will also tell you more about that. So we don't know it all. We just get the knowledge and gather it, and of course sometimes it becomes unique on our own after we worked for it for a while. I have a video here of the mobility course. So this shows the training that we were doing in Iceland with our teachers. So we had 4 staff members, and then we offered the course to 4 people outside our institute, and most of them, the 4 others were working for the commune in Reykjavik, so we're hoping to spread the knowledge. Let's see if it works.
Og nú ætlum við að fara inn í herbergið og hurðin opnast út.
So they are doing training in how to open a door and walk with a guide through a door.
Hér handrið.
Training how now Helena, who is our staff member, is being a mobility teacher and train how she trained another person going down the stairs with blindfolds. And cane user. Just hit the pole. And the reason why we chose the course from Denmark is because that's very much hands-on and you have to do a lot of practice on your own. Once you start doing the courses that are on master's level, they are more theory. But we wanted people to experience and do the practice themselves. And then later on, they can maybe go to the master's level if they want to.
Yeah.
She's trying to find the door of a bus by using her hand and a cane. So even though people had been working at our institute for quite a time before they did this mobility training, they say it was life-changing just to have to experience how to use a cane for themselves. And they were always extremely tired after each day at the course. So we did it last September, so the teachers from Denmark came in for 1 week in each month, so over 4 months time. So, and so they did a distance course in between. Vala will show you some of the devices we are allocating. All of these devices are free of charge, and we assess each individual what they would need, if they need a braille display, if they need glasses, visual aid, cane or whatever. And it's really important that we do the assessment, we do the training, and then we do the follow-up. So in most of the countries, the aid is under one centralized service, but this is unique that it's under our service. But that is actually, we think it's better because we know what is out there. We are always researching what is out there, and then we are able to buy and try it out and test it. And test it also with our clients. So even though it's not on the list for allocated devices, our clients work very closely with us in telling us like what works for them and what doesn't. We handed out 1,600 devices in 2024, and that doesn't include the glasses. We make our own glasses for our clients. But this is like mostly magnifiers, canes, and CCTVs. I'm just thinking if I should wait with this slide. It's about the guide dogs. So and have Vala maybe tell you about it later. So Estella will get her minutes. But we have a question. Yeah.
Hi, my name is Brett. I'm from Social Insurance Board. And can you once more tell me the route about the client, maybe one case study, where your center is located at first, and when the client comes from, I don't know, any far apart from the Iceland, how does the route go for herself or himself?
Mm-hmm. Okay, that's a very good question. We have, Estella is going to tell you about that in a little bit. So I'm going to skip the guide dog slide, and we're going to show that later. One last slide from me before Estella tells you about the journey of our users. Of course, you want to know how much it costs. So the total budget is for our center is 3.4 million euros, and that includes all the assistive devices and the transfers. And when we talk about transfers, this is the help, the assistive devices and also the glass refunds. So that doesn't really make the numbers totally correct, and what goes to the VI population and what goes to the general public. Of course, if we would have had the same money as when we started, we should have had around we have a lot less now than when we started because of inflation and cutbacks and everything. But this is the status now, and I think because just to make sure that we have enough time, I'm going to ask Estella to come up and talk about the low vision and the journey of the client, and then also after lunch you will get to know more specific for children and adults. F. I'm going to be on the side if she needs me. That's why we said there would be two of us. So if somebody would, if we would lose the words, we would help each other out.
Yes. You hear me? Yeah. Okay, fine. We work by the definition of the World Health Organization on vision impairment and blindness. And we talk about the categories of low vision and blindness from 0 to 5, and then we have category 9. In the 0 category, we have put children with mild vision loss that might be discharged when older. They enjoy the benefit of the doubt until they are 18. Also elderly that still have visual acuity above our limits but struggle with reading and have age-related degeneration. They may have, because they have started their journey into losing their vision, we accept them when the vision is still above. We say 0.3 or 30% or 6/18. When we say 6/18, it means that the vision impaired sees in 6 meters what the full seeing sees in 18 meters. So the category 1 is when the visual acuity is like 6/18, the best spectacles correction, or visual field less than 20 degrees. The next low vision category 2 is the legally blind person who has visual acuity less than 660 or 10%, with visual field less than 15 degrees, or they might have half visual field. We have blind categories from 3 to 5. And in the 3rd category, the person has a visual acuity less than 360 or 5% or visual field less than 10 degrees. The low vision category 4 is vision is measured in finger counting within 1 meter and hands movement, or light perception. And you find the totally blind in category 5, and that means the person doesn't have light perception. In that way, we have a lot of people in category 1, low vision and as legally blind, and much less in category 3 to 5. The term legally blind is to give person in category 2 the same rights as the blind persons. We communicate with the officials and the blind union about the population behind the categories, and it's also a mean of communication between our staff members, so we understand something about the vision of the client before they arrive. The admission team is where the client journey starts. The admission team has the role to go through the referrals and accept or reject and decide the first encounter. That will say which staff they are offered to meet. The team also registers the right low vision category that will secure the rights for proper aids. Members of the admission team are our ophthalmologist, our service manager, an optometrist, and the service manager for the special educational advisors. We meet once a week and go through the referrals and medical notes. The team evaluates from the referral if they need to meet an optometrist or both an optometrist and a staff member, skilled in ADL, activities of daily living, or maybe the social worker. The new children always meet with a team of ophthalmolog, special teacher, and an optometrist. The number of new referrals are about 250 per year, plus medical notes for existing clients. With degenerating eye diseases, people experience changes and need a re-evaluation if there is a need for visual aids. About contact person, Elfa talked about earlier, but it's usually the children that may get contact person appointed when the admission teams meet. Other usually later in the process of the first encounter when they have full overview of the service needed. Okay, the referrals. The referrals we receive are mostly from ophthalmologists, but they can come in form of inquiries from individuals, relatives, assistive living homes, schools, and local authorities. We can also receive referrals from other institutions, for instance, like the Counseling and Diagnostic Center and the National Hearing and Speech Institute. We are obliged to guide everyone who one, how to make the referral count. If a relative makes an inquiry, we give proper instructions, what documentation we need. We always need the documentation from the ophthalmologist on eye and vision status to be able to accept the referrals. Our ophthalmologist is for support, not primary diagnose on vision impairment. Yeah, should I?
Yes, I will ask in English. If you have a referral from school, for example, and how often does it happen that the child hasn't been to an ophthalmologist? Do you then refer the child somewhere else, or you conduct what has to be conducted? But yet again, you said that you don't diagnose, right?
No.
Yeah.
We have often, I think, we have had through the years inquiries from schools, and we will have to advise them to make the parents talk to the ophthalmologist or bring the child to an ophthalmologist, and if there are reason to refer to us. Yes.
Yeah, we are having more cases like that because of cerebral visual impairment. So the schools are doing more inquiries, but usually the child has already seen an ophthalmologist. So we just encourage the ophthalmologist to send in the documents, even though they didn't get the medical diagnose, because we, especially with the children, we allow them to benefit the doubt. So it's more like we are more stricter when it's like the like what we call the normal optical diseases. So, but the children always get. We always look into the children.
Thank you. Okay. Background of clients. Of the 1,700 clients registered in our system, the largest group and the oldest group have vision impairment due to age-related macular degeneration. That is when the specific light-perceiving cells in our retina stop working properly and die, usually a rather slow process. The number of clients with this disease are around 54%. They usually lose the sharp vision and hold on to peripheral vision for a long time. Glaucoma, which is often caused by raised intraocular pressure, but not always, counts for roughly 6%. Sometimes, if people get old enough, they have both glaucoma and macular degeneration. Retinitis pigmentosa, which is the leading cause of blindness within the client group of working age, counts for about nearly 6%. That usually leads to profound loss of peripheral vision, but there are variations. The cerebral visual impairment is the number 4 cause all over and number 1 within the children group. We have seen increase in referrals due to diabetes and insults to the brain the last 10 years. The journey of a new client. The admission team, where the journey starts. Most clients meet first an optometrist, which performs functional vision assessment. The client may meet other professionals in if referral gives indication as category 2, legally blind or working age, then the client may need to meet an ADL skilled person or know his rights and meet the social worker. If referral shows the client is in blind category, a team is created. A team meeting, if first visit really reveals need of many services, then we call a team meeting. Contact person is provided if the person needs many services or a long time service. Once you are a client, you are a long life client. No need of new referral unless you get cured and are dismissed. You need to come back later. Statistics today. By the end of 2024, there were about 1,720 individuals in our blind register. Of these, 210 children, aged 0 to 18, yes, that's about 12%. Approximately 400 were individual aged 18 to 67 years. That's about 22%. And about 1,100 were aged 67 and older. That's about 65%. This number has not changed since last year. The number of registered users remains in line with population growth in Iceland and is about half percent, 0.5 of the national population. A little bit more about the children, to give you an example. Among the children, in the low vision category 0, we have 46 children. We give the benefit of the doubt. We may assist if they have had congenital cataract and need follow-up with glasses and or visual stimulation. Also, children with early diagnosis of RP are in our register. Some children in category 0 will drop out of our register when they are 18. In the first category, low vision category, we count 66 children. In the second category, 18 children. And in the blind category 3 to 5, 12 children. And in category 9, 68, which many of have cerebral visual impairment, at least 37. Common diagnosis for vision impairment among children other than CVI are like nystagmus, congenital cataract, optic atrophy, retinoschisis, retinitis pigmentosus, and albinism. And then there are many, many more. Maybe one or two. It's just many. Question?
Thank you. This is Jakob Rosin from Estonian Blind Union. A quick question. Well, the numbers are similar, at least the ballpark, to what we see in Estonian. Mm-hmm. How often do you see, let's say, political pushback on the small numbers? Because in Estonia, when we end up discussing the amount of blind or visually impaired children with various ministries or adults in general, the question about how many people do we have come up. And when we go to the numbers, I could quote ministries who say, well, that's not big enough number, so you can figure it out yourself. So are Icelandic ministers much more sensible people, or do you have to actually work on this a lot, or is it established enough that you don't have to worry about funding reduction or any other kind of changes in the system? Thank you.
Yeah, I think I would.
Sorry.
It's okay.
No, it's a really good question, because yes, we have had cutbacks, but because the Blind Association is very strong in Iceland and very good in getting into the news, so nobody wants to be very bad to blind people. So that's very, they help us a lot, and also because our registry is very correct. I mean, these are referrals from ophthalmologists, so we always know our numbers are correct, if I understood your question correctly. So having that national database is really important, because then we can always say how many are in service, and like 1,700 clients might not seem a lot, but we are of course seeing a lot more, because we are serving the elderly population, and that when you're elderly, in the end you die. But the statistic usually stays around the same and increases with the population. Is that, do I answer it well enough, or do you want?
Yeah, thank you. I was sort of curious. Is the mic working? Yeah, I think it is. I was sort of curious, like, do you see from the government side any will to change the system, because I think the fact that you are very strongly established in the way the whole system works is a good benefit. But has there been like discussion on we need to cut back or reduce the funding or change something in the system? Thanks.
It's been done very quietly. Like I say, we started out 25 positions, but now we are 20. The easiest way to get money into the system is to tell them about all the new technology and changes. And if we don't get the money for that, people will not be able to participate in society. So that's how we have been able to, even though we haven't been able to keep the manpower necessarily always up, but we are able to increase the allocated devices that the changes are so fast. And Vala will show you later today Iris Vision, which is one of our allocated devices, which we got special funding to do. So we often have to, not often, but we have to meet the committee at the parliament to sell them the idea. And the way we do that is very unconventional. We take the equipment with us so they can really see what it does. Usually, you just write letters and discuss things. But this is, if we demonstrate, people understand.
I have two. Can I take them?
Yeah, sure.
Service for the deafblind population is scattered. We provide service regarding vision and the National Hearing and Speech Institute in hearing, allocating hearing aids. But services cost money there. The Communication Center provides sign language teaching and interpretation. Our institute got the responsibility for integrating services in the laws without the power to make other public services to commit or legally binding. The population is about 100 with congenital and acquired deafblindness and about 200 with age-related deafblindness. The numbers of the age-related fluctuate because of the age group. In 2013, we had the first meeting in an interdisciplinary functional assessment team made up by representatives from us and the other institution I talked about earlier. The assessment is rooted in ICF, International Classification of Disability, Functioning, Disability and Health. It was a task given to us by the ministry after the user organization demanded there should be performed a functional diagnosis or assessment. The Nordic Welfare Center organizes courses and promotes education of service providers for people with deafblindness. Since it is a small population in all the Nordic countries, we can learn from each other. The Nordic Welfare Center Division Deafblindness made Iceland a priority in 2013. They provided us with course on how to recognize deafblindness. They helped us to organize a course about deafblindness for different service providers, and all lectures were professionals from the Nordic countries. Since then, we have benefited from participating in the networks and attended courses organized by NVC. We also have a good cooperation with the user organization Fjóla, which is extremely important to be able to provide the right services. Það einu eftir, ætlaðu að segja eitthvað? Nei. I think.
Yeah, before we take lunch, I just wanted to sum it up. The future of VI services in Estonia, if this is something that you would be interested in, doing a similar concept, we would suggest that you build from down up, use the grassroots to advocate for the services, see the person as a whole, and the life of a person as a whole, because that's also what is unique in our system, is that we service all ages instead of you have a different service if you're at school and different service when you're an adult. And we are there for each other, that, use the networks and use the NGOs, and the VI is a community, whether you're a professional or a person with visual impairment. Do you want to take questions, or are we gonna do lunch?
Ja, teeme ühe aplausi.